you do an evaluation so that you can screen out people who need to get other kinds of care.
Yeah.
But for the most part, in the vast majority of cases of back pain are mechanical.
Yeah.
In other words, they are affected, they're some kind of musculoskeletal situation that's affected by positions and movements. That seems to be the simplest way to define it. And if you can analyze the problem by looking at the effect on the person's symptoms, which they report to you or to themselves, if you can analyze their symptoms in terms of positions and movements, and there's structured movement evaluations that you can do, then you can give very specific instruction to the person as to how to ameliorate or get rid of their back pain in many cases, even where the person has been diagnosed with a herniated disc, even when a person has had chronic pain for 1 or more years. I have had patients, they don't necessarily, it's not every person that walks in, but I remember this one lady, she was maybe in her 60s, who had had chronic back pain and sciatica for at least a year or two. And I was able to evaluate her and give her something to do, and the evaluation always leads to a tentative diagnosis. You give whatever your treatment is in terms of instruction, particular exercises, some postural advice, whatever, and then send the person home and you make another appointment for a follow-up. And lo and behold, this lady did the exercises I gave her religiously, and she was better.
Yeah.
She was pain-free within a day for symptoms that she had been having for a long time. I don't have the history in front of me, and it's been a while since I thought I recalled it, so I can't give you the specifics, but it was a year or two. She was having pretty much constant daily back pain. So that kind of exceptional thing has happened often enough, and things that aren't maybe so exceptional but are in a way equally dramatic, where people really end up being able to do a whole lot better with the simplest kind of treatments.
Yeah.
Paying attention to their posture more can make a tremendous difference. You had asked me one of the early questions before is what led me to write the book. It was the frustration of seeing people like this and thinking about all the time that they spend and all the money they spend, and the frustration and the long periods where they had pain, where they didn't really need to have that pain, and where they really didn't need to spend all that money and go through all the tsuris, all the trouble that they went through before they saw me. And what did I do? I just taught them things that are easily available for anybody who wants to look. There's no mystery to it. You need a trained person to help you learn these things and maybe to evaluate the problem. But most people can deal with if they learn how to do it, can learn how to manage their problems themselves. So they don't need to be dependent on a practitioner. And that was, and still is, it's just a tremendously frustrating thing. And I think it applies to other aspects of the healthcare system as well. That people aren't being taught, aren't learning adequately the things that they can do to help themselves. And as a consequence, we have a lot more expenses and a lot more medical problems than are necessary, that people could learn how to take care of themselves more. Not entirely. Sometimes you need more than you can do with self-help. But though the possibilities of self-help in all aspects of medicine have barely been explored now. And that is a crying shame. In 2011, in the 21st century, we should be doing a lot better.
How much can Alexander technique help with the clarity of your thinking?
That's an interesting question. I've done so many things concurrently with the Alexander technique that I feel have helped clarify my thinking, that I'm not sure what I can't say that I could have isolated the effect to the Alexander technique. I'm sure that it's had some just to the extent that once you've learned it, so that you've developed certain, shall I say, objective standards for use, that you can then begin to observe yourself with a better and more accurate way of knowing what you're doing when you're doing an activity, and be able to observe, what am I doing with my neck? Am I holding my breath? Am I straining unnecessarily? Am I using too much effort? Just all those kind of questions that you learn how to ask and then you observe. That's a process of thinking, of observing and describing, if you want to put it into words.
Yeah.
And it's a practice that's going to help you to become, and to the extent that you're doing it, you're developing clarity in your thinking when you're doing that.
Yeah.
But I don't think that it necessarily generalizes to other aspects of life, although it can if you decide to generalize it.
Yeah.
I think what's necessary is, it's what's known in athletic training and sports coaching, and it's a time-honored principle of the specificity of training. And if you want to become clear in your thinking about any aspect of your life, then you have to, I think, apply the various principles of clear thinking and observation and so forth to those aspects of your life that you're concerned about. So I know that there are Alexander technique teachers who, it's like anybody, who may be rather fuzzy thinkers in other aspects of their life.
Yeah.
So, there's aspects in which Alexander technique training obviously has a clarifying effect, but it's not a panacea. But nothing is.
So, how much do you think overly tense muscles and poor use of oneself is going to negatively affect one's thinking?
That is a whole huge area in medicine and physiology that has been neglected. And I think there's been a number of people over the years who've worked on it. Wilhelm Reich, Alexander, Moshe Feldenkrais. Krzyzewski certainly had his views on that and developed some techniques that he felt were important. What he talked about in terms of thinking was that when a person, we think with our whole organism. And when we talk about thinking, there's a tendency to objectify it, to objectify the word, and to separate thinking from feeling.
Yeah.
And one of Krzyzewski's bugaboos was doing that, and he felt, and I agree, that there isn't, in a normal person with a normal intact nervous system, there is no separation of thinking and feeling. You can isolate them as different aspects of how human beings abstract and evaluate their worlds.